I wanted to answer a question that oftentimes gets asked in my office, and that is, maybe it's someone who doesn't have children or hadn't thought about children in chiropractic, and, they see other patients in my office, or maybe they hear a newborn, a little one in the room next door. And they oftentimes ask me, was that a newborn? Do you adjust little ones? Why would you adjust them? How does that work? And so let me explain to you a little bit about why you would see newborns in our office and why chiropractic helps out with newborns. And so we like to call that first adjustment the reset adjustment. The reset adjustment because to help out with the nervous system to function better for these children and where their challenges might lie may go all the way back through development in utero. And so if there's any stressors, if there were chemical stressors as they were developing, if there were heightened emotions that were going on for the family while they were developing, but also the birth process itself. Maybe, before the birth, maybe there was an in utero restraint or positioning challenge of the baby. And then coming through and welcoming into this world, there could have been some challenges with the birth. Maybe there was a quick birth, a long birth, a cord around the neck, maybe something had to been used like forceps or vacuum, and there's just so many different reasons, and even the most beautiful natural of birth still involves forces and vectors to get into this world. So why would a child be into our office? Obviously, if there was any of those things that might went on, but some of the things that parents might see, the child might have colic or reflux, or the head's tilted to the side called torticollis, or there's breastfeeding challenges. Maybe a child has a tongue tie or lip tie, and a lactation consultant referred them in to be able to get great body work to help to adapt after a revision or with what was going on. And maybe they're constipated, or honestly a lot of the children, because I see a lot of the pregnant moms, they start to understand the benefits of chiropractic, and that reset adjustment is really more of a wellness where they don't have any symptoms, but it's the parent saying, hey, I want to get my child, the very best outlook on life and have the brain and the body communicating together. Now, of course, the next question that pops up is, okay, I'm an adult, this is a little one, how do you adjust that little one? And we oftentimes say the amount of pressure that's being placed on the spine, it's just like tapping maybe a ripe tomato or an eraser. It's just super, super gentle. And so it's much different than what it looks like for an adult. And, and then some of the benefits, yes, to any symptoms that might be going on, but some of the benefits, there's just so much growth and development that's going on during that time. And so the spine doubles by the age of 2. 65% of the neurodevelopment occurs in that first year of life. And then going back to that question of maybe there was challenges during the birth. There was a medical doctor, Dr. Gutman, who did research and looked at 1,000 kiddos. And this research was a little older, but what he found is that 80% of those children had a misalignment or pressure being put on their spines that he saw right after birth. And so chiropractic in the pediatric world, we even have discussions now where some of the experts are honing it down to say, some of the increased stressors in life, that there's maybe 90-95% of children, and I find that to be true, that have pressure on the upper part of the neck. And so as you can see, what a great benefit it is for newborns to be adjusted, whether they have challenges or parents want to get that reset adjustment just to make sure that everything is working properly as they embark on this life.